What kind of dog do you have?
He's a schnoodle.
I'm sorry.
He's a
A
schnauzer
schnapp.
poodle.
Really?
Yeah.
That is a unique. I don't know if I've ever seen it. What color?
Black, curly. It's like a fancy name for a mutt, right? He's a
No, you had me though. That was your poodle. That's Wait, a schnoodle? Schnoodle?
noodle.
Schnoodle.
Yeah.
I dig it. I dig it. All right, cool. Let me do one more thing. Make sure we're like ready to go. Do you want to let him out?
Yeah, I don't know what he's barking at. He's going to just keep barking. Let me just go do whatever
Cool.
he
No
needs.
problem. Yeah. No problem at all. I tell you, sometimes dogs, dog will train you. I had a dog once upon a time, and Lola, I always think about you. And yeah, Lola had me trained. That's all I'm saying.
Okay, we're good. Dog is out.
So funny. I'm like, once upon a time I had a dog, and they let us know what's going on. They're like, hey, it's time. We don't always know for what. But anyway, thank you for being here with me. Ladies and gentlemen, those of you all watching or happen to be listening via the Mental Flight School podcast, I want to introduce to you Dr. Deb Matthew. She is known as the Happy Hormones Doctor and is a best-selling author, international speaker, a wife, and a mom of 4 boys. You go, girl. She is a frequent guest expert on podcasts, radio, and TV news and talk shows with more than 60 appearances on NBC, ABC, CBS, and Fox. Dr. Deb suffered for years with exhaustion and irritability, and her quest to restore her own health led her to change everything in how she practices medicine. Interesting. Now, instead of treating diseases with drugs, she helps resolve the root cause of your health issues to get hormones back in balance so you can get well, get off prescription drugs, and love the way you feel. You're a bad mother. Shut your mouth. Please welcome Dr. Deb Matthew. How you doing?
I am good. It's great to be here.
Awesome. Thank you for being here. Thank you for taking the time, especially with this particular subject. And I find it to be really important. Prescription drugs is huge, and the discussion about what people can do. Are there any alternatives? I'll start off with this question. What's like one of those things that people generally misunderstand about what they should do or how they should do it?
Yeah, we go through our life day by day. We do the things that we see everybody else doing. We go through the fast food drive-throughs and, we sit and binge watch Netflix. This has all just become normal to us. And the problem is our normal lifestyle creates disease. It makes us gain weight and get diabetes and high blood pressure and heart disease and cancer and all kinds of bad things. And we have learned that if we don't feel good, we go to the doctor. They give us a pill for it. Sometimes we feel better. Sometimes we just have to stay on the pills for, ever. But that's what we sort of know to do if we don't feel good. But if we would learn how to make some changes, they don't even have to always be hard changes. We could feel so much better and not need the prescription medicines.
Really? So in terms of some easy fixes, like right off the top of your head, what are some easy fixes that help?
Okay, so the first one is to do your very best to ditch the sugary drinks, the sodas, the monsters, even fruit juice is loaded with sugar. And the reason is when you're drinking the sugar, it's like mainlining your blood sugar straight up. And when your blood sugar spikes up, that causes a problem with insulin. And insulin's a really important hormone. It is the fat storing hormone, and it's going to stick fat right around your midsection. It's going to eventually make you gain weight, make your blood pressure go up, make your blood sugar go up. It creates disease. And sugar is really addicting. Anybody who's tried to not drink the sugary drinks knows, like sometimes we just crave them. And it's so normal in our society to drink these drinks, but it's really, really bad for your health. So if you can ditch the sugary drinks and replace them with water, herbal teas, there's other options out there. It will help you to clear up your brain. You feel more productive and more energetic, and you sleep better. You will feel better.
First off, I didn't ask you to talk to me specifically. This was for the audience. You were not supposed to be talking to me in my truck. No.
But it's such a common thing, right? It feels so normal, but it's really, really harmful.
And you mentioned briefly, if we can just dive in just a little bit, you mentioned it, could clear up the brain. Like, what does that piece mean? Because I know some folks are trying to learn about the brain and what it does, but that piece right there, how so?
Yeah. That's another really common thing, right? Is like we just feel flat or like we can't focus on things. We're not remembering things. Like we got this foggy brain sometimes. And if you are trying to make something out of your life, if you are working hard, you got a career, you got a family, you need your brain to be sharp. You can't forget everything. You got to be on. And when you have a lot of sugar or, the other kind of junk foods, you're not feeding your brain the nutrients that it needs to stay sharp. On the other hand, if you choose a salad instead of the French fries, if you're eating fruits and vegetables, if you're making healthier choices, that provides the fuel that your brain needs, and you'll sleep better, you'll have better energy in the day, your brain will be on and sharper, and you'll just feel better. And it doesn't have to be all or nothing. It's not like you can never enjoy treats, but if you can make a conscious effort, less of the treats, more of the good stuff, you'll feel better.
Thank you so much for that. Now, what inspired this? I know that, sometimes there's I call it like East Coast, West Coast in terms of, the thought process in this kind of living from a physician standpoint. So what inspired you to say, hey, this option exists for you if you're willing to take it?
Yeah. Well, I didn't used to be so great. I used to feed my kids at the McDonald's drive-through multiple times a week. I mean, we were feeding them sugary stuff at home, just like it was normal, right?
For sure.
But in my own personal life, I was exhausted all the time. Like having a nap was my most important project for the day. I was irritable. I mean, I was flying off the handle at my kids way too often. And my poor husband did not know what the heck to do with me. Because one minute I was in a good mood and the next minute I was, this crazy lady. And I didn't know what to do with me. There was literally nothing in my medical training to help me understand what was happening to me. But I was just putting one foot in front of the other, trying to get through the day. And I did the things that really had to be done today. But if it didn't have to be done, it kind of just got left by the wayside because I just wasn't really feeling it.
Wow.
And I started to learn more about healthy living. And actually what really happened is I read a book written by Suzanne Summers.
Really?
And, doctors hate getting our medical information from celebrities. But I did read this book. And it really helped me open my mind to understand how hormones affect us and how our lifestyle habits affect our hormones, like our stress hormones, our insulin, et cetera. And once I made some changes in my own life, I felt so much better. It was like this complete transformation. And I'm not perfect now. I mean, I still enjoy treats. I don't always exercise. I do my best, but it's made such a difference. And so I just couldn't go back to being the kind of doctor that just writes prescriptions all day long because we're not really helping people. We're just putting Band-Aids on the symptoms. We're doing some damage control for the diseases, but we're not really making people well. And, right now with this COVID-19 going on, if you've got some of these underlying health challenges, the high blood pressure, diabetes, obesity, those kinds of things, you're more at risk. But you can take control of your own health. You can do some things to really reduce the impact of those conditions. You can actually get rid of them altogether if you really go for it, and you'll feel better too.
Well, number one, thank you for making that, especially the last statement you made in terms of folks understanding that they're actually in control of some of these ailments that they may have been dealing with for years, or no, this is hereditary. This was passed down to me and I can't do anything about it. So ultimately what you're saying is there's something that you can do about these things.
That's correct. So even if there's genetics behind it, typically the genes only count for about 20%, and the decisions that you're making every day count for 80%. So if you're all stressed out and don't have healthy ways of dealing with stress, if you're not, going for a walk or doing some exercise, getting some vegetables in your diet, you are taking those genes and you are just pushing them right towards the disease.
Wow.
But if you can make some better choices, you can really protect yourself from whatever genes you were born with. So we can't fix everything 100% of the time, but a lot of the time you can make a big difference in your own health.
Right. So folks, really quick, listening, watching, whatever you're doing, right? However you're consuming this, understand like that 20% may exist, right? But then there's that 80% of just some simple disciplines that you can begin to add to your lifestyle and your eating and the way that you exercise that can alter and change things for generations to come, if that's what we're really discussing. That's amazing. So how do your patients respond to this? How do they feel about these alternatives that you've given
Yeah.
them.
So typically in the very beginning, they're a little bit worried or hesitant because they're afraid it's going to be real hard. And they're afraid I'm going to take away everything that they ever, enjoy in their life.
That's what I'm
But
afraid of. No, I'm just kidding.
when we start somewhere, like for example, a really great place to start is just to cut out the sugary drinks. So if you can cut out the sugary drinks, eventually that taste for sweet kind of diminishes and it gets easier with time and you start to learn other things that you enjoy. And it just becomes a habit and it becomes easier. And then you start to go for a walk. You don't have to do a marathon. You don't have to do a triathlon, but you can start going for a walk. And so as we keep adding some new habits, you feel better and better and it gets easier to maintain them. So you don't have to do everything all at once. You don't have to be perfect. But every step in the right direction is going to start to make a difference.
Wow. So a couple of things as we, kind of close out. I did hear you mention husband and you also mentioned sons, and I happen to read in your bio, 4 sons. So
4 boys.
4 boys. And I happen to know how boys can be, being one myself. So what is that like? And even in relation to what you do for work, like what's it like being a mom to 4 boys, a wife? What is that like?
Yeah. Well, they are loud. They are dirty. We don't have a lot of drama. Like for girls, they freak out if they can't find the shirt that they want to wear. The boys just open the first thing and hold it out, or maybe it was just off the floor. I don't know. But in some ways they're easier. In some ways they're louder, and they eat a lot.
They eat a lot. It's I only have 1 son, and he's not even 2 yet, but I'm convinced he eats a lot. But that's nothing compared to 4.
Well, just wait. Just wait.
Well, I'm gonna get him. He's already on the. We're trying to do a good job with he only drinks water, and he's never had a McDonald's French fry. And I think other parents, look at us like we're crazy, but we're like, no, we're not gonna do it. So it's just again those small things that happen, and sometimes I guess his eating influences mine.
Yeah. But, do your best job, because right now you have control over it while he's 2. As he gets bigger and bigger, society is going to have all those influences. It makes it harder. But you will, if you demonstrate at home good habits, that really matters a lot, because kids will learn what they see. So if you're saying eat your vegetables, but you're eating the donuts and they don't ever see you eat vegetables, you're saying it isn't going to work. They have to see what you're doing. And you don't have to be perfect. But if they just see that it's normal to eat vegetables with dinner, then it's normal to eat vegetables with dinner and they'll eat them. At least some of the time.
At least some of the time. Because I do it some of the time. So some of the time. Thank you so very much for all of that incredible information. Do you have any final thoughts, or how can people learn more about you and get more information about this?
Yeah, sure. So I have a couple of things. So sometimes the reason, especially for women, that we don't feel that good, like we feel flat and overwhelmed and exhausted, is because we have a hormone issue, a hormone imbalance. And this can be true for women of any age. So right from puberty all the way past. So for women, if they kind of wonder whether maybe how they're feeling could be from a hormone problem, I've written a book. It's called This Is Not Normal, A Busy Woman's Guide to Symptoms of Hormone Imbalance. It is available on Amazon, but you can actually get a free ebook at isityourhormones.com. So isityourhormones.com, you can download an ebook. It's got all kinds of quizzes and things, so you can sort of check off and see what might be the problem and get some tips on what you can do to fix it. I also have a website which has information for women and men. It's called signaturewellness.org.
Awesome. Thank you so very much, Dr. Deb Matthews, the Happy Hormones Doctor. So make sure this is not normal. This is not normal. I will make sure to put a link in all the possible areas and certainly in the show notes so we can check that out. And also make sure you go to signaturewellness.org. Thank you. It's been an absolute pleasure having you, Dr. Deb. Hopefully you'll come back again and spend a little more time with us. And thank you for being you and what you do. All right.
Thank you so much.
My pleasure. For those of you all watching, remember that 24/7, 365, and 14 days a year, that you're good, you're great, you're worth it. And it's going to take effort and discipline, just like Dr. Deb said. So remember that effort on fire beats knowledge on ice. So time to do something. My name is Sam Pierce II. You heard it here first. Peace.